When most people think about Southern Hills corridor, they really think about the retail. Your Target, Lowe's, our Southern Hills Mall, and all the restaurants we have around here, and of course our Lakeport Commons. But one of the most important changes in this part of Sioux City has actually been happening in healthcare. Over the last decade plus, Sunnybrook has developed into a significant outpatient medical destination. Today, patients can come to this area for family medicine, pediatrics, urgent care, cardiology, rehab, imaging lab work, infusion services, and much more, all without visiting the main hospital campus. So why did healthcare choose this location? And why do we continue seeing medical practices move toward retail-style commercial corridors all over the country? Today, Jennifer and I are breaking down the commercial real estate behind Sunnybrook's medical growth and why this part of Sioux City works so well for healthcare.
For decades, people associated healthcare with one place, the dreaded hospital. You went downtown or to a traditional medical campus, parked wherever you could, navigated a very large building, and found the department you needed. Healthcare delivery has changed. More procedures, diagnostics, rehabilitation, physicians' visits, imaging, infusion services, and routine care can now happen in outpatient environments. Unity Point says Sunnybrook Medical Plaza opened in September of 2013 in anticipation of a major increase in demand for outpatient services. That statement is important from a commercial real estate perspective. This facility was not simply built because land happened to be available. It represented a larger healthcare strategy. Put the services closer to where patients live. Make them easier to reach. Provide convenient parking. Create another entry point into the healthcare system. And separate services that do not need the hospital environment from the much more expensive hospital campus. That last part matters. Hospital real estate is incredibly expensive. The physician plant is highly specialized. There are emergency functions, inpatient rooms, operating rooms, backup systems, specialized utilities, security requirements, and enormous infrastructure demand. A routine clinic visit does not always require all of that. Outpatient real estate allows healthcare systems to match the building more closely to the service.
Why Sunnybrook? So why put the facility here? Unity Point specifically describes Sunnybrook Medical Plaza as being located right off Highway 20 and Highway 75 bypass for convenient patient access. That's the first major advantage, accessibility. Patient may be coming from Morningside, Sergeant Bluff, South Sioux, Dakota Dunes, North Sioux, or even a smaller community outside the metro. Healthcare serves a regional population just like retail does. The difference is that a patient may already be stressed, uncomfortable, elderly, traveling with children, or unfamiliar with the city. That changes site selection. A medical practice wants a patient to say, I know exactly where that is. Not, I think it's somewhere inside a complicated office park. Sunnybrook has recognizable landmarks. Target, Lowe's, your major roads, of course the bypass, retail development. Those landmarks make wayfinding much easier. That sounds simple, but patient convenience has commercial value.
Parking is more important than visibility. This is one of the biggest differences between medical real estate and traditional retail. Retailers often pay premiums for visibility, but medical users often pay premiums for convenience. If you're choosing between two medical sites and one is on the most visible corner in Sioux City but requires patients to park 300 feet or more away, while another has a slightly less exposure but allows patients to park right outside the door, I may prefer the second site. Think about the patient population. Some patients are elderly. Some use walkers or wheelchairs. Some are bringing young children. Some are recovering from surgery. Some are actually coming to physical therapy because movement is already difficult. That means we examine things like accessible parking, curb cuts, door widths, elevators and escalators, drop-off areas, covered entrances, sidewalk grades, snow removal, distance from parking to reception. These features may matter far more than whether 30,000 vehicles can see the sign. In medical real estate, convenience becomes part of the patient experience.
Look at the services already here. Sunnybrook Medical Plaza is not simply a collection of general practitioners. Unity Point currently lists services including family medicine, pediatrics, urgent care, foot and ankle care, infusion center, rehabilitation, cardiology, imaging and breast screening, lab services, and pulmonary and cardiac rehab. Think about the traffic those uses create. A pediatric clinic serves families. Cardiology serves an entirely different patient demographic. Imaging generates scheduled diagnostic visits. Lab services may bring repeat visits. Rehabilitation can require patients to return multiple times per week. Infusion therapy can involve extended appointments. Urgent care creates unscheduled patient traffic. Together, those services create a medical ecosystem. And just like retail clustering, medical clustering creates advantages. A physician can refer a patient to imaging nearby. A patient may complete lab work during the exact same trip. A cardiology patient may also use rehabilitation services. The more services located together, the more convenient the overall destination becomes.
Why retail and medical work together? This may seem like an odd combination. Why would a healthcare facility want to sit near Target, Lowe's, restaurants, and shopping centers? Because people's lives do not happen in an individual zoning category. Patients may have a 10 o'clock appointment and stop at Target afterwards. An employee may grab lunch at a nearby restaurant. A parent may bring a child to pediatrics and complete grocery or household shopping on the same trip. Medical employees may use surrounding salons, gyms, banks, restaurants, and services. Healthcare creates strong daytime population. Retail creates convenience for patients and employees. That relationship can strengthen both. The city of Sioux City currently describes Sunnybrook as a rapidly growing retail area, incorporating retail, banking, and medical facilities with major anchors including Target, Lowe's, Marshall's, and Unity Point Sunnybrook campus. That combination is exactly why we consider Sunnybrook more than a retail district. It is becoming a true mixed commercial node.
Now let's add housing. The original Sunnybrook Village plans combined commercial development with a major multifamily residential component. The Summit at Sunnybrook Village delivered 225 apartments, and a second phase Summit Ridge at another 73 units. This is very important. Healthcare follows population. Retail follows population. Restaurants also follow population. Financial services follow population. And when people live immediately adjacent to all of those uses, the area becomes more economically productive throughout the day. Think about the cycle. New housing creates customers. Customers support the restaurants and the retail. Those amenities make the housing way more attractive. Healthcare providers gain convenient access to patients. Healthcare creates employment, and employees support the nearby services, of course. That reinforces the entire district. Commercial development rarely happens in isolation. Strong districts usually develop because multiple uses support one another.
What medical users need that ordinary offices don't? Here's where medical commercial real estate gets complicated. You cannot assume that a normal 5,000 square foot office can easily become a clinic. Medical users may need significantly more plumbing, additional electrical capacity, specialized HVAC, backup power, medical gas, lead shielding for imaging, specialized sinks, ADA upgrades, wider corridors, patient restrooms, and then staff restrooms, exam room plumbing, biohazard storage, specialized waste handling, higher parking ratios, additional fire and life safety improvements. And a dental office may require plumbing throughout the entire floor. Imaging equipment may require structural and electrical upgrades. Physical therapy may need large open areas, and urgent care needs exam rooms and patient circulation. Infusion requires comfortable long-duration treatment areas and medical infrastructure. This is why tenant improvement allowances become extremely important in medical leasing. A landlord may look at a 7,000 square foot medical tenant and think, fantastic, credit, long-term lease. But if the building costs several hundreds of thousands of dollars or potentially much more, the economics need to support that investment.
One reason investors like a medical tenant is what we call stickiness. Once a healthcare practice invests heavily in a location, moving can be disruptive and uber expensive. Patients learn the location, the equipment's installed, plumbing's embedded in the walls and the floors, and referral networks start to recognize the address. The staff builds routines around the property. That can make medical tenants less likely to move casually. But that does not mean every medical building is a safe investment. Investors really need to ask, how specialized is the build out? If this tenant leaves, can another medical user use the space? How much of the improvement actually belongs to the landlord? And what does the tenant pay? How strong is the tenant's credit, of course? How long is the lease? Are there annual rent increases? And who maintains specialized systems? A beautifully built medical suite can be valuable or extremely expensive to convert back to normal office use.
What other medical users could fit in this district? Looking at the existing medical infrastructure, there are several healthcare-related categories that often make sense around established outpatient districts. Potential examples include dental, which we have right behind us, orthodontics, dermatology, optometry, audiology, behavioral health, women's health, which we actually have down the street, physical therapy, chiropractic, prosthetics and orthodontics, medical equipment, specialty pharmacy, senior healthcare services, ambulatory services. But this does not mean every one of these uses is currently looking for space. It means the location characteristics are comparable with those business models. Medical clustering can also create referral relationships. A patient coming for one specialty may learn about another provider nearby. Doctors value proximity to complementary services. Patients value completing multiple appointments in one area.
Let's talk future outlook. Sunnybrook's story is not simply medical growth. It's mixed use growth. Retail, housing, healthcare and restaurants, your banking, hotels, highway access, and the city continues to treat this part of Sioux City as an active growth area. Today, city planning materials still include additional site plan activity and development agreement work involving the Sunnybrook properties. We expect medical and health-oriented uses to continue being an important part of this district because the fundamentals remain very strong. Easy patient access, growing surrounding commercial activity, recognizable landmarks, nearby households, abundant parking, and an established outpatient healthcare destination.
If you only think of Southern Hills and Sunnybrook as Sioux City's retail district, you're missing a big part of the story. Healthcare has become a major component of this corridor, and that tells us something important from a real estate commercial standpoint. The best districts evolve. They do not stay exclusively retail, exclusively office, or exclusively residential. They add uses that support one another. Sunnybrook has retail customers, healthcare patients, employees, residents, hotel guests, restaurant customers, and regional visitors all moving through the same district. That diversity is one of the reasons this area deserves attention from business owners, developers, tenants, and investors.
Thank you so much for joining us today to talk about the healthcare portion of the Sunnybrook corridor. Make sure you subscribe to our channel to learn all things commercial real estate. Have a great day.